Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. The next medication we're going to look at is biologics. Now with biologics, they are new treatments that can be used to treat IBD as well as other conditions. And they are called biologics because they are made from substances that are found in life. These medications are made in the laboratory by creating antibodies that can stop the proteins that are responsible for causing inflammation in the body. These antibodies are known as monoclonal antibodies, which are man-made antibodies that can act like the ones found naturally in the immune system. Biological drugs used to treat IBD can include Adalimumab, Golimumab, Infliximab, Ustekinumab, and Vedolizumab. Now, generic medications that are used are small and simple in structure, which makes them easier to replicate and quicker to mass produce. This is not the case of biologics, which are complex in structure, and the process of making them takes much longer in comparison to other drugs. And it's not always possible to make an exact copy of the biological drug due to the use of the monoclonal antibodies. As a result, biosimilars were created, which are biological products that are like the original biologic drug, which means they can be administered in the same way as the original product, have similar strength and doses as the original product, produce similar side effects as the original product, and are cheaper to produce than the original biologic. Now, the original product of the biologic is the main brand of the drug and is known as the originator. And any product or brand of that original medication is known as the biosimilar, which is similar in structure, safety, purity, and how well it works. Now, some biologics can be classified as immunosuppressants because they act on certain cellular pathways or individual proteins of the immune system, and depending on the process they target will depend on the class the drug belongs to, of which there are three types. You can have anti-tumor necrosis factor agents. So these drugs are classified as anti-TNF drugs because they prevent tumor necrosis factor, which is a cell signaling protein that is involved in promoting inflammation from producing its effects. Then you have integrin receptor antagonists. These drugs bind onto specific cells in the gut, which prevents immune cells from entering the gut that may cause inflammation. Anti-interleukin drugs work by targeting interleukin 12 and 23 pathways in the body, which are involved in promoting inflammation. So how do biologics actually work? So anti-tumor necrosis factor agents or anti-TNF agents such as Adalimumab, Golimumab, and Infliximab work by preventing the action of TNF. So normally TNF can bind onto specific receptors that cause a cascade of pro-inflammatory effects. TNF binds onto receptors and causes the increased production of pro-inflammatory proteins that are released by the cells of the immune system. This then activates a series of pathways that causes neutrophils of the immune system to stick to the gut to signal other immune cells to cause inflammation. Anti-TNF drugs bind onto TNF to stop this happen, thereby reducing any inflammation that impacts the gut. When we look at integrin receptor antagonists like Vedolizumab, these drugs are known as gut-selective integrin blockers, and they work by blocking alpha-4 beta-7 integrin and the mucosal addressing cell adhesion molecule 1 interaction in the gut. The mucosal addressing cell adhesion molecule 1 acts as a signaling beacon for specific immune cells to bind onto them so they are allowed to enter the gut and cause inflammation. Vedolizumab prevents this from happening, thereby reducing the inflammation within the gut. With interleukin 12 and 23 antagonists like Ustekinumab, we need to know that in the body there are two immune cells called macrophages and dendritic cells which release interleukin 12 and 23. When interleukin 12 and interleukin 23 bind onto cell receptors, it activates Janus kinase 2 and tyrosine kinase 2. This causes a series of events to occur where immature immune cells are allowed to specialize into cells that can activate other immune cells and promote inflammatory responses to occur in the body. Ustekinumab is designed to bind onto both interleukin 12 and 23 to stop them from producing this effect, thereby reducing the inflammation that is seen within the intestines. Now, no drug is ever side effect or risk-free, And because we are all different, not everyone will experience side effects or the same types or severity of side effects. And it's always important to notify your doctor or IBD team of any concerns or symptoms that you may have when on medications. Now, side effects will vary between medications, but the most common side effects of biologics include, but are not limited to, allergic reactions. So these can happen when injecting or infusing biologics and can cause redness, itching, bruising, and pain at the site that it is being injected or infused in. This can cause headaches, chills, fever, and in some cases, an allergic reaction which can cause hives, rashes, and difficulty in breathing, which can be fatal and requires immediate medical attention. It can also cause arthritis, and even though biologics can be used to help treat arthritis, they can cause new joint pain and discomfort. There is also a risk of having cancer, especially with anti-TNF drugs have been associated with a very small risk of cancer. And you can also encounter some liver problems, as biologics may cause changes in liver function, which is why tests will be done prior to starting biologics to check the health of your liver as well as your own individual health. Certain skin conditions such as rashes can occur when on biologics, and it has been reported that anti-TNF induced psoriasis can actually occur. And then lastly, we have infections. As biologics weaken the immune system, any dormant infections which were kept under control before starting biologics may start to cause health problems. In addition to that, you may find you'll get more infections than usual and may take longer to recover from those infections.